Welcome to BPS Live. My name is Steve Ronan. I'm a plastic surgeon here at Blackhawk Plastic Surgery, part of the Premier Network. I'm here with my lovely friend Brett, who's helping me out tonight.
Hi, Dr. Ronan. I'm so glad to be back with you guys. This is our third show already. Thank you for joining us.
Fantastic. So as you get questions, make sure you put them in the chat so we can address those at the end. But we're going to start our segment today on the aging face and some of the things that we do for patients who come in with concerns about an aging face. Let's talk about what happens with the aging face. One of the primary things is loss of facial fat. And as that happens progressively, the lower eyelid hollows out, the jowls are created, and there's laxity on the neck. In addition, there's also sun damage and time. And sun damage leads to changes in the coloring of the skin, brown spots, reds, wrinkles, fine lines, and texture changes. So we have a whole host of things that we can do that are small all the way through doing an entire face to address each of these issues depending on where you are in the process. Early on in the process, a lot of patients will benefit from things like a toxin and fillers and laser. And so these will stop the wrinkling process. They're protective against burning in wrinkles into the skin. Fillers can replace some of the early volume loss, raising cheekbones, filling in nasolabial folds, adding to the lips. And lasers can sort of address some of the sun damage and wrinkling that's happening earlier on in the facial aging process. As we progress further, we still use these tools, but we might be slightly more aggressive in addressing the process. So a very popular procedure that we do is fat grafting of the face and laser resurfacing. With that procedure, you have a little bit of sedation. We take some fat from the abdominal area or inner thighs, and with a couple needle sticks, we replace volume back into the face, under the eyes, cheekbones, mid-face, nasolabial folds, marionette, and this restores a larger amount of volume than you would with fillers. In addition, the volume is long-lasting, with at least half of it being permanent. While we do that process, we'll do laser resurfacing, where we remove the sun damage and very aggressively treat the wrinkles. This procedure has about a 1 week of downtime. It's pretty easy to go through, but you get swollen and bruised for about a week. Very good standalone procedure for someone before they're ready to do their face. We do it while we're doing the face, and it's a great tune-up for someone who's had their face done previously, but just wants a little bit more rejuvenation. Some point enough time's passed, and there's enough facial aging that it's just time to do the face. The smaller things won't be as efficient, won't really give you the results that you're looking for, and so we need to be a little more aggressive. So when we do the face, we do it in the OR with an anesthesiologist. It takes about 3 hours. There's really a cluster of procedures for the upper and then the lower part of the face. On the upper part of the face, we're talking about the brow and the upper eyelid. So typically what happens is the brows rotate downward from the outside in, and then there's extra skin and maybe some extra fat on the upper lid. And that leads to sort of a fullness over the upper eye. You can't see the entire lid. So the way we address that is some small incisions in the hair where we can come down and lift the outer part of the brow. What we don't want to do is lift the center of the brow. If we lift that, the patient has sort of a surprised look, very unnatural. So we want to bring the outer part of the brow up almost where the patient is trying to hold it themselves. We also remove a little skin from the upper lid and extra fat. Pretty simple procedures. For the bottom part of the face, there's a cluster of procedures that go together, and typically this involves the face, neck, lower lid, and fat grafting. So as we talked about before with the volume loss, we take some fat and graft it into the face to replace some of the volume loss. Most people's loss is actually greater than what we can fit in at one time, which means they'll never be overdone or look puffy. In addition, fat doesn't have that sort of puffy, swollen look that fillers do. So we can put a lot of fat in and give it a diffuse sort of overall result. After adding that fat, we actually need to lift the cheek tissues from underneath straight up or slightly back, but not straight back, which is a little more traditional way of doing it. If you lift the cheeks straight up, it will correct the jowl and force more tissue into the lower lid area, which has been hollowed out. And that gives the most natural looking result. This is done through a short scar from sideburn to just behind the earlobe. And with this technique of adding fat and lifting, we really don't have to take out very much skin, which is why we need a much shorter scar. So we've talked about the upper part of the face and the lower part of the face. And the third component on a typical face is laser. And so what we'll do is laser resurfacing, and we'll use a couple different kinds of laser. One of them is confluent, or treating the entire surface very lightly. It takes off the extra pigment, the brown spot, sun damage. The other laser goes a little bit deeper, but it's fractional. It's sort of like aerating a lawn with little tiny spikes of laser. So most of the tissue is not lasered, it's fractional. And that allows a lot of wrinkle reduction, but it heals very quickly and it lowers the risk considerably. The old lasers were confluent throughout and deep, and they had a very long recovery time, could change the color of the skin, and maybe give a waxy appearance. We've come a long way. We're probably 10 generations of laser beyond that. And with the fractional lasers we have now, they're very safe, very quick recovery. They don't have a waxy look, and they won't change your pigmentation color. During your consultation, we're going to figure a bunch of things out. First off is all the things that concern you. So I'm going to want to know what's bothering you and have you point at it and say, I don't like this and this and this. And then I'm going to make a plan and recommend some things to you that are going to address those exact concerns in the most efficient way. Too often, I see patients who have gone to a number of places and had procedures that didn't address what their concerns were and were a complete waste of time and money. And so I'm not going to do that. You're going to hear it very straight from me. This is what's going to address your concerns and make you happy. If you're asking me for procedures that won't work and I know they won't work, I'm going to tell you that's a waste of time for you. You should stick with something that works. It's very important to do things properly, to figure out what are our concerns and pick procedures that are going to address those. That's what's going to ultimately make you happy. What we won't do is prey on fear and do procedures that we know aren't going to work for you. So let's talk about the day of surgery. Today, you're going to have your full face done. So what does that mean? You'll come check in, come back into the OR. Our anesthesiologist will put you to sleep, be watching you the entire time. We'll work for about 3 hours doing your entire face with laser. Afterward, you're going to wake up and go to recovery and hang out there for a couple hours until you're ready to go home. Your family or friends will take you home, and you'll have about a 2-week period before you're ready to go back to work in an office type setting. Faces typically are not very uncomfortable. They're pretty easy to go through. It's much more visual. You get swollen, you get some bruising, you have the laser process, and really for the first 4 days or so, it looks like you're getting worse. Around day 5, things start to shift and you start to get a little bit better. And by a week, you're coming back up, and that's when we'll see you and make sure everything's okay. Between the surgery and the first week, you'll have a lot of change. You'll have just as much change between the first week and the second week after surgery. So usually at 2 weeks, most patients are ready to go back in public. And at 4 weeks, most patients are ready to have pictures at maybe a wedding. During those 2 weeks, you really feel pretty good, and you'll be able to walk around at home. We don't want you straining, going out in the sun very much. But if you can work from home, you'll be working from home very quickly. You probably won't need much more than Tylenol or Motrin after the first 48 hours, because these procedures really are associated with a very smaller amount of pain. If you're having a smaller procedure, for example, an isolated neck lift, it's the same process. You'll come into the OR. It'll only take about an hour. You'll then go home. You'll have a garment that kind of compresses on your neck, keeping the swelling down. And most patients are going back to work within a week. Those that can work from home, oftentimes they'll be working the next day. Let's talk about risks associated with the facial procedures. There's always a general risk of having any kind of a surgery, and those would be things like having a problem with anesthesia or infection. But specific to faces, a few of the more common things that we might deal with is bleeding. So it's possible that after you leave the OR, you could start bleeding in the recovery room or at home. If that were to happen, patient just comes back in, we open it up, stop the bleeding, wash it out, and close it. End result is a little bit more swelling and bruising on that side, but the final result is the same. Also, patients will have some numbness or nerve issues. And typically, they'll have some numbness on the sides of the cheek and the neck area where we've worked. And over a period of a few months, the numbness improves and comes back to normal. On the brows, it's also possible and likely that you'll have some numbness across the forehead until the nerves sort of recover and regain their efficiency. After having their face done, patients often ask me for a plan for maintenance. So what are the things that we would typically do? We have a variety of things, and it really depends on that particular patient. Some people have more wrinkles or less than others. Some people have more sun damage or less than others. Some people have more volume loss or less than others. And so the kind of things that we'll typically do is toxins to help prevent wrinkles from coming back after laser, skin care, certainly to control the pigmentation and help with the health of the skin. Occasionally fillers, although that's less likely if we've done fat grafting. And then maybe some more medium level laser procedures like a secret fraxis. So secret fraxis is topical numbing, microneedling with radio frequency, and then a lighter version of the fractional laser. And that has like a 24-hour period where you're a little red or look sunburned, but a very quick recovery. And so these can be done periodically to keep improving and or maintain your skin after the bigger laser. And typically what we'll do is put together a package of these on some frequency. So we might do some talks every 3 or 4 months. We might do a secret fraxis every 3 or 6 months. And we can create a membership program for the patient where it's just a monthly fee, and we'll see them at designated times to keep up their maintenance program. Let's take a look at some before and after pictures. This one is a very typical face patient who has the normal complaints of facial aging. And so she had our standard sort of facial procedure. And the first thing I want you to look at is she just looks normal. Everything looks kind of just cleaned up, but doesn't really look like she had surgery. Now, when you're looking at this lateral view in the before picture, you can see that the weight of the cheek is towards the bottom. And by adding volume back in and lifting the cheek, the weight of the cheek shifts up to the upper part of the cheek, emptying out the lower part of the cheek. Very important. When you look at the lower lid area, you'll see it's kind of empty and ragged. And once we move the volume back in, remove a little bit of extra skin and do laser, you'll see how it's nice and full with a nice transition, very smooth. When we look at this 45 and you look across the patient's face in the before, you'll see that the cheek outline is straight up and down. That's because the weight has descended downward. In the after picture, what you'll see is a nice S curve where there's much more weight of the cheek up high and very little down low. And so that nice curve is youthful and keeps the face looking very natural. When you look at the neck, especially from the lateral view, you'll see that it's a nice 90-degree angle with not much excess skin and extra fat removed. This is another very typical kind of patient. So she has a much more difficult neck, quite a bit of sun damage. And so with our facial procedure, we're able to improve her neck, give her a more 90-degree angle instead of being so obtuse. And you can really see the power of the laser. And so the laser has really cleaned off the surface of the skin, removed the sun damage, decreased the wrinkles. And overall, she has a very non-surgical look. Everything just looks a little bit brighter and a little bit happier. This is another very typical facial patient, complains of looking tired. Sometimes people will tell her that she looks angry. And so we'll do our typical facial procedures. You can see that the neckline gets improved, much more like a 90-degree. On the 45 picture, again, if you look across the cheek, you'll see that instead of a more flat line, she has a nice S curve with more volume on the top of the cheek than the bottom. Eyes just look brighter, looks happier, does not look like she had surgery, doesn't really look a lot different, just everything looks a little cleaner and a little brighter and a little happier. Thanks for tuning in to our episode on facial procedures. We would be happy to meet with you and discuss these things in private in our 13,000 square foot facility with our private surgical center. If you have any questions tonight, please write them in the chat and we'll get right on to our Q&A segment. Welcome back. So funny thing happened as we were switching from the live to the tape segment. We had a couple patients try to get in the door and thought there'd be a live audience tonight. So we've sent them across the pond over there to have a glass of wine, and now they're watching us as well. So hello to you guys, and we hope to see you back soon. So Brett, you want to switch over to the Q&A section of the night?
Definitely, yes. So guys, everyone who's joining us, please be sure and put some questions in the chat for us. We'd love to answer live for you while we're all together. We do have a couple questions that was given ahead of time. And Dr. Ronan, let's start with Stephanie asks, will you tell me if a procedure isn't right for me?
So that's an absolute yes. I do that every day, and I probably do that in near half the consults that we do. And so it's actually very important. It's part of my job and my responsibility to tell you if something isn't right for you. And that includes something that I think isn't harmful but won't do the job. And so my job is to listen to each of your concerns. I really don't want to know what procedure you want. I want to know what are your concerns and what areas bother you. And then I need to make a plan that will address those concerns, and that's what will make you happy. And so there's times when patients come in asking for a larger procedure, and I know that we can do something smaller. Or there's times when patients have a significant issue that they think can be cured by a needle or a laser, and I have to kind of let them know that, nope, this is going to take a surgery. But it's something that happens every day in quite a bit of consults that I'll tell someone something that's not appropriate for them.
I can kind of speak to that as a patient myself. I remember asking Dr. Ronan for a trouble zone that I had, and I thought I knew what the right procedure was. Dr. Ronan had to tell me a little differently.
Yeah, so going back a little bit, Brett complained to me about the neck and asked about doing some liposuction of the neck. And liposuction of the neck, I found over the years, is not a great procedure. So when we do a neck lift, we take out the fat with liposuction, but we also undermine the skin and go under the muscles and take out more fat and tighten up the muscles. So the skin undermining, the fat under the muscle, and the tightening the muscle is a little more procedure than a liposuction. Not a lot, but a little more procedure. It makes a similar recovery, but it actually is substantially better result. So I kind of quit doing neck liposuctions a long time ago because for a little more work, we can get a lot more result.
I love it. Still going strong. So a couple questions. When's a good time to have a facelift?
Well, variable is the answer. It really depends on when you present. There's some families that lose fat in their face faster than others. And so those patients will come to our office with complaints on the earlier side. And so the good time to do it is when you have enough changes that the surgery will give you enough benefit that it's worthwhile to do. Because the procedure we do looks so natural, I'm completely comfortable doing it on a younger patient. You can't take a very young patient and make them look surgical, or at least you shouldn't take a very young patient and make them look surgical. But there are patients that will come in with significant aging of the face and younger. And so I'm sort of reminded of a few people. One was a swimsuit model who got terrible acne scarring, like as bad as I've ever seen. And it had done all kinds of treatments for it without really much improvement. And so we did sort of a modified facelift on her at 28 years old, and it really helped smooth out a lot of her acne scarring. Yet she looked entirely normal when we were done, and she was pretty thrilled with the result because nothing else had really worked for her. The second thing I'm remembering is a couple, and they'd been married a long time. I think they were high school sweethearts. They were both in their late 30s, and he looked like he was, 25, and she looked like she was 45, but they were the same age. They looked 20 years apart, and they'd come in together to ask what they could do for her. And she was pretty upset because a lot of times when they would go to dinner, people would say, "Oh, is it nice that your son's taking you to dinner?" And, this was her husband, and they'd been together for a long time. And I said, "Well, I know you're on the younger side, but there's a procedure we can do to address these concerns. And I promise you're not going to look surgical." And sure enough, we did the procedure, and it was kind of problem solved. They were able to go out and enjoy themselves. They looked much more age appropriate.
I have a great question here from Lisa. Can this procedure be combined with rhinoplasty?
Absolutely. So, in fact, oftentimes it is. The facial procedures, face, neck, eyelids, brow, fat grafting, ears, nose, can all be combined together. The things that don't play well together are the laser resurfacing and the nose. And the reason for that is we have a splint on the nose, and we can't laser and put the splint on. So, or we just can't laser the nose area. And so typically we'll hold off on the laser, do the nose with the face, and then maybe circle back for the laser later.
Perfect. I think that kind of ties into Susan's question. Can you wear glasses or contacts after face and neck lift? Maybe with laser too.
So, depends on what we're doing. If it's just fat grafting and laser, you can put glasses on fairly quickly, contacts as well. If we're doing eyelid procedures, we won't want to pull on the eyelid to put in some contacts. And so we'll typically start glasses earlier and then wait for contacts until later.
Perfect. Dr. And there's been some chat over social media that we have a lot of patients come to us with, and I just wanted to bring this up. You hear a lot of things about fillers in certain places or even strings. Can you talk about that a little bit?
So with respect to the strings, I'm not really a huge fan. Putting strings in, pull something up, as soon as they break, it's going to fall back down. So when you do a surgery and you open things and you lift and put in tiny sutures to hold them, as they heal, it will hold it up. When you put strings in a couple threads and you kind of go like this, you can lose the lift almost immediately. And I've had many patients come from places with strings with problems or loss of effect almost immediately. So I'm not really a big fan of the strings. Fillers are fantastic. They're a great advancement in plastic surgery, especially when they're used appropriately. So fillers don't cure everything. A lot of the stuff you kind of mentioned, social media and lots of injectors try to use fillers to do everything, it seems, these days. And it works great for lip augmentations. It's really nice for filling nasolabial folds and elevating a cheekbone. But it's not that great when you have a more substantial volume loss and you're trying to sort of feel that. If you overdo with fillers, you get that sort of puffy, swollen, non-natural look that I'm really not a big fan of, with the sort of elongated chin and the giant cheekbones. And I think it looks kind of unnatural. And I think we can actually do much better with some of the other tools that we have. And so while I think fillers are fantastic, they just need to be used in a more appropriate way.
Yeah. I just, even this week, we've had some patients come in with some fillers, some bad fillers from other places.
One of the problems I see a lot, twice today, multiple times this week, last week as well, it actually seems like it's a little bit of an epidemic, of fillers in the lower lid. And so lower lids are a big problem. They're like one of the first places you see the volume loss as people are deflating or losing fat in their face. One of the first places you see it is the hollowness or the bags under the eyes, gets a little darker. And a lot of injectors like to fill that with filler, with an injectable filler. I'm not really a big fan of fillers that lower lids because a decent amount of patients will get swelling that is prolonged and can last years. Today, I saw someone that had lower lid fillers in 2014 and still has swelling and a dark color underneath her lids. I saw another one today that it was 2 years ago and still has that problem. And so there's treatments for it. We can remove it and we can fat graft into it, which I think helps it quite a bit. But from my perspective, I don't think fillers should be used in the lower lids. There's plenty of other places where they work great. But there's kind of a lot of problems, I think, with fillers in lower lids. So I kind of advise maybe not doing that and at least seeking an opinion on fat grafting, because I think it's like head and shoulders better than a filler for the lower lid.
Perfect. I have a question from Susan. If you lose weight after having a facelift, will it affect the outcome of it later?
It really depends on how much weight loss. If you have, small, medium-sized weight loss, it might not have that much impact. If you have a significant weight loss, might create some deflation. Most likely, you'd be able to recover some of that result with a fat grafting session, which is good to do for most patients some years after a facelift anyway. So it's sort of a tune-up for a facelift would be fat grafting and a laser. And so I think a lot of times it would be covered with that. It'd be hard pressed to find someone who lost so much weight that we need to repeat their facelift. In that case, it would probably end up being kind of one of those good problems to have, because that means they, lost so much weight and are much more healthy.
I have a question from Sophia. She asks, what if I'm not ready for surgery? What else can I do?
There's lots of things that we have, and it really depends on what the concern is. So non-surgical things, we really have like a whole variety of things. So we have toxins like Dysport or Botox or Daxxify. And so those go into the small muscles here of expression around the eyes and the forehead and sort of weaken those muscles so that you see less wrinkling. We have our typical injectable fillers, which provide volume, whether it's the lips, the folds, cheekbones, etc. We have a whole variety of laser and technology procedures. And so those can be things that target vessels or redness or brown spots, target fine lines or deep wrinkles or texture. We have a device called an Ellacor where we can remove tiny plugs of skin, about 0.45 millimeters. And when that little plug comes out, it collapses down and heals without a scar. Tiny change, but if we do 20,000 of those across a face and the lips, that provides, a pretty decent amount of tightening. And so there are skin tightening procedures that we can do that don't involve surgery. Skin care is another thing. Skin care, I think, is oftentimes overlooked. It's actually pretty important. It's one of those things that everybody should be on because it helps turn over your skin. It helps you keep the browns away. Keeps your skin healthy.
This is a question we get all the time. Am I going to look normal after surgery?
So we hope so. That's our goal. And there are some people and styles of surgery that look very surgical. And there are some people that like that look. That's not what we're about here. We want people to look entirely normal. So it reminds me of a patient we had that really lives pretty close, a couple miles away. Absolutely wonderful patient. We did, pretty much her whole face, and she was pretty happy and loved it. And at some point returned to her monthly group that played cards or games. And after about 6 months, they sort of broke the news to her that they thought she got ripped off because it didn't look like she had surgery. And so she was sort of, thought the surgery was great, but wondering, well, why would they say that, and concerned, and kind of came in and talked to me. And I chuckled when she told me this story. I said, let's go take some pictures. And so we took some pictures and I printed off her before, after, about 5 copies. Showed it to her. Pretty remarkable change. And of course she was thrilled. She actually forgot like how much change it was, which is pretty common, because if you make someone look normal, their brain adapts to it and they kind of forget the before. And so that kind of happens. She's like, wow, like that's awesome changes. I said, great. Now take these and throw them out next time you play your game and let them all see the difference. And they'll be shocked when they see what a change it is. But even they, your best friends, couldn't figure out that you had surgery. It didn't look like you had surgery. And that's really what we're trying to do here.
I love that story. It's so true. You want to look normal and you're going to.
Yep.
Susan is chiming in. If you have dark circle or bags under the eyes, will a facelift also correct this?
Sort of. So it's kind of it's more complicated answer. And so let's go over that. As you lose fat in the face, which is one of the primary things of facial aging, it'll start hollowing under the eyes. And then eventually you'll lose enough that the face deflates enough that you'll create jowls. And then a little bit more and we'll have laxity on the neck. So depending on where we catch you in that process, we have to do varying amounts of things. So if we catch you early, we might only do fat grafting, which means 2 needle sticks. And then we can put fat in various places in the face and help with those sunken eyes or bags that people call them. If the process has gone further and there's sun damage and the skin's kind of wrinkly and the texture is not as good, then we'll do a face with it. So we'll lift up the cheek, and you can take your finger and put it right on this triangle. You could take it there and lift up and watch what happens to your lower lid. You can watch the volume go into that and actually improve the area. So if we do that, and we also remove just a little bit of extra skin and fat graft the area, so we're restoring volume with fat grafting, we're elevating the cheeks back up where they were, and then removing just a little bit of skin, that oftentimes will treat the bags and correct that area.
Amy's asking, how does one determine if they're a good candidate for facial fillers versus a facelift?
Okay, another great question. Not too hard, right? So if you have smaller things like just nasolabials and you want a little more cheekbone, or you want to augment the shape of the face with a small amount of volume, then fillers work great. If you progressed to the point where you have hollowness under your lids, then we're going to be more talking about fat grafting. And if you have some jowling and neck laxity, then we should be talking about a facelift. Really, when you have jowls, fillers just aren't that good. And you have to use a lot of filler to get a mediocre result. And so it's not very efficient. And you're really just trying to band-aid it at that point. Once you have the jowls and neck laxity, we should be talking about a facial procedure.
So Emma's asking, could you explain the difference between Botox and dermal fillers for facial rejuvenation? And I know a lot of patients ask me, I want Botox to fix something, and maybe explain the difference.
Tox, general category, Botox, Dysport, Daxxify, that is a protein that binds a certain receptor that doesn't allow a nerve to talk to the muscle. And if a nerve can't talk to the muscle, it just sits there and doesn't do anything. And so when we put toxin to frown lines, forehead lines, crow's lines, we basically paralyze the muscle. It doesn't really get any communication with the nerve. It just sits there and doesn't fire. And because of that, you're not constantly remaking the wrinkle. So it sort of decreases the wrinkles overall. So that's what a tox does. Fillers, on the other hand, provide volume. It's like a clear gel that you inject and it pushes out to provide volume. And so we have different types of fillers. Some are very thin, some are medium, some are very thick. We typically will use like a softer, thinner variety in the lips because we want it to be soft. And we'll use a more muscular variety in like cheekbones or an area that we really need to bulk lift and need more strength in that lift, as opposed to like a little volume in the lip, which would make it softer.
Perfect. One more question here. Do you have any type of computer program where you can simulate a before and after, where they can see what they might look like?
So I think most of you have that on your phones already, probably better than what we have with different types of filters and different things. And so I'm a little reluctant to just use a filter on someone and then claim like that's what we're going to do with a procedure, surgery, or otherwise, because I don't feel it's super accurate, and I would feel bad promising something like that. I actually said earlier today, I promise you'll look natural. And then I kicked myself because that's probably the only time I've ever said I promise in this office. And I actually said it on live TV, which is still burning me. So I should never ever say, promise again. But
how about more of a surgical aspect? Do you have to be asleep?
So if you're going to have surgery, it's best to be asleep. If we're doing smaller procedures, we can do it with you sitting in a chair. So it really depends on what we're doing. I'm not a big advocate of doing surgical procedures on people while they're awake. I think it's safer for you to go, it's safer and you're much more comfortable for you to go to sleep when you're having a surgical procedure. Being half awake, worrying about your airway or if you're going to breathe or, what your blood pressure is, all those kinds of things. I don't want to do that while I'm trying to do my procedure on you. And I don't want to be hurting you when I'm doing a procedure. And if you are hurting someone during a procedure, it really is stressful and it's hard to focus on what you're doing. And so when I do surgical procedures, I want an anesthesiologist there who's absolutely expert, who puts you to sleep and keeps you very comfortable. And their whole focus is that you're safe and that you're not feeling anything. And then I can do my procedure and not stress about hurting you or whether you're taking enough breaths or a deep enough breath or what's going on with anything, because I have an expert there who's much better at it than I am anyways. And they're sort of taking care of that. We find that is safer, it's smoother, the procedure goes faster, and we can get a better result. This idea of doing stuff half awake, I'm not a big fan of. I think it came from places that don't have access to surgery centers or aren't trained and qualified to be able to go into surgery centers. And it saves you a few bucks to do it that way. And so I've sort of never been a fan of that. I really, really enjoy using the anesthesiologist for all of our bigger surgical things.
Speaking of surgery centers, Dr. Ronan, can you tell everybody about ours?
Sure. So we have two accreditations. So we have a Quad ASF accredited surgery center, which is some agency that one of the bigger ones that accredits surgery centers. But we also have Medicare. Medicare is a much more stringent accreditation that not very many centers have. And we set ourselves up that way right from the beginning back in 2005 when we opened it. So we have 2 ORs and 5 recovery beds. We have all very modern technology and our what we use to sterilize the instruments is the same kind of thing you'd find in a very modern hospital operating room. So our technology is very good. Our HVAC system has all these HEPA filters, and it's a similar kind of thing that would be in a sophisticated hospital OR environment. So we want to do that here. So we sort of had what we think is the best of everything. But we've been around for a long time, and we're coming up on 20 years at the surgery center. But it's been really a fantastic place to work. Now, one benefit is that I work with the same people every day. When you go to a hospital, you kind of don't know who you're going to get, either anesthesia-wise, circulator-wise, which is the nurse, or scrub tech-wise. You might have a lot of the similar people, but there's a lot of variability. And then in addition, the instruments aren't exactly what you want. It's what they have. Our facility is designed in such a way that we have the same people all the time, and I have set instrument trays for exactly the procedure I'm doing, and they're all exactly what I want, so it makes everything run very smoothly. So that increases our efficiency quite a bit, like fantastic amount of, like when I do a case in the hospital, it might take 2 or 4 times longer than it does when we're doing it here. The benefit for you, I'm doing the same exact thing, but the benefit for you is you're asleep a lot less, And so it's easier for you to wake up, and there's less problems the shorter you're asleep. So we really focus on efficiency and getting you asleep, procedure done, awake without wasting really a minute while we're in there. We just think that goes better for people.
We have such a great team too that you work alongside, and very efficient, definitely. Amanda wants to know, how long is a facelift recovery?
Good question. So if we do an everything face, neck, lids, brow, fat grafting, laser, I usually tell people at 2 weeks, they're ready to go out in public. The first week, they'll be pretty swollen and bruised and peely, and they'll probably look like they're getting worse for the first maybe 4 days, start to panic a little bit. Then around day 5, it kind of doesn't get worse, and then it starts getting better, and they'll be at 1 week noticeably better. And then the second week, there's really also a rapid improvement. Most patients at 2 weeks are ready to go out in public, can put on a little makeup if they need to. Most people at 1 month are ready to take pictures at a special occasion like a wedding. As far as activities, after about 3 weeks, we can start low impact aerobics. Before that, walks are fine. 3 weeks, we can do more intense low impact aerobics, and really a couple months before you lift anything heavy.
So we have time for one final question, and that's from Hannah. What post-treatment care regimen is recommended to optimize and prolong results after a facelift?
Good question. So could be a variety of things, and it depends on you a little bit, and so we'll customize it exactly for you. Most of our patients are getting laser, and so they're going to start with a sort of a goopy one the first week, and then at your first post-op appointment, we'll start you on a skincare program, and we'll sort of set that up, and we'll design it, for your skin post laser and what you need. Some people need more anti-browns than others, so sort of varies a little bit. After that, we can create a customized plan for you. Even with our membership program, we might be doing a little tox. We might have really a lot of sun damage and need to continue some smaller laser procedures. Various things. And so we'll typically design a program, a maintenance program, if that patient wants, and do it with our membership, where we'll just regularly see you every 3 or 4 months for tox, and perhaps do another laser procedure involved with that as well.
So Dr. Ronan, that's all the time we had for questions. I'm just going to go over our specials one
Perfect.
more time and mention the raffles that I promised. We're going to contact the winner tomorrow, but everyone who attended tonight, we're going to pick one winner will have a hydrofacial treatment, one winner a laser genesis treatment. We're going to have a $1,000 gift certificate towards a surgical procedure. Pretty exciting.
Well, thank you everybody for tuning in tonight. We're happy to see you. To our friends who went across, come on back over. And if you want to ask any questions, we're here. We'll be here for a little bit, and we'd love to chat with you. And until next month, we'll see you back on BPS Live. Thank you everybody for coming.
Thanks, guys.